welcome everyone. Just as a reminder, we met before Christmas where we heard fabulous presentations from colleagues from the All Party Parliamentary Group on temporary accommodation. They gave us a sort of a taster of what was to come. And then we also heard from health visitors who work in this space and their perspective, and also the fabulous opportunities that are available for care leavers if they're given a chance. But what we did do was we ran out of time, so that's why today this is going to be largely a listening exercise to find out from your perspective what's happening out in the region. The discussion today is likely to be emotionally charged. Nobody goes into working in this space without wanting to make a difference. And I'm just conscious that we need to be respectful and kind to one another. Don't want people to feel that any profession is being singled out for blame. I think it's really important that we recognise that we're all working together on this agenda, and we do what we can to support one another. The other thing that I wanted to say was that for those that are new to the network today, is that we're a collaborative, a broad church of organisations and individuals that have come together under the auspices of homelessness and inclusion health. But we don't have any funding per se as a network. We are governed by the Association of Directors of Public Health. So that's where our governance lies. But what we can do is signpost to available funding that becomes available and encourage collaborative working on bids. But as I say, we don't have any funding per se. I'm just going to share my slides. And start it at the beginning so that you can see, and I just want to go through the aims and objectives of the session. So the aims of this session today is to raise awareness of the recent report from the All Party Parliamentary Group into temporary accommodation, understand the impact of a poor home environment on child mortality, which was part of that report, and then collectively identify the themes that can inform a programme of action that we can take forward as a region, which will provide guidance and support to the local systems. And the objective is to hear from you today about the issues you're facing with children, young people and their families, those experiencing or at risk of homelessness in our region. So explore some of the challenges that you may have, and also hear of the examples of good practice and solutions that you found to get around some of those. And then what we can look at doing as a region is how we can work together to try and tackle some of the recommendations that's in the All Party Group report. This is just an overview of the agenda. And so you can see we've got a very tight agenda if we are wanting to have the full 20 minutes per breakout session. So I'll remind our guest speakers today, if you could keep to time, maybe finish slightly early if you can. So if there are any questions, there is an opportunity to raise them. And then we can explore some of the issues in the breakout sessions. So without further ado, I'm going to hand over. I can see Sam on the call. I'm going to end my slideshow because I don't know whether you have slides, Sam, that you want to present. So this is Sam Pratt from Shared Health, who acts as a co-secretariat to the All Party Parliamentary Group on temporary accommodation. And I know he was one of the co-authors of that report. So over to you, Sam.
Thanks, Karen. Hi, everyone. I'm Sam Pratt from the Shared Health Foundation, and my colleague Emma is on the call as well. How long have we got, Karen?
So I'd say about 10 minutes to speak and allow 5 for a chat.
That's fine. I'll give a bit of overview of what the parliamentary group's about, and I think my colleague Emma and Andrew did that last meeting whilst I was away. and then kind of like our next steps really. And then if anyone's got any questions about the report or specifics of it, I'm not going to read the whole thing to you. It's 44 pages long. You don't need to hear that. I'm sure you could read that in your own time. But I'll give a bit of an overview of the kind of like the politics around it and kind of what you can do locally in your area as well. And then Emma, if you might want to talk a bit more about the kind of child mortality area of it, as is on the schedule for this meeting, if that's all right. So our parliamentary group came about when about 5 or 6 years ago we were working with homeless families in Greater Manchester, because we saw that come through our clinical work in primary care, and realised there was something called temporary accommodation, which at that point we'd never heard of, and we weren't really aware of those types of kind of health inequalities. And then the more we dug into it, the more realised how many children and families are in temporary accommodation, whether it's emergency like B&Bs and hostels, or whether kind of more kind of longer term temporary accommodation, homeless accommodation. And there's multiple issues with that. So there's the actual quality of the accommodation, which is impacting on health and well-being, but then there's also the lack of support and the lack of notifying of services that these families are here. We know there's like a specialist homeless health visitors network around the UK that are kind of working with homeless families and homeless households, but it's a very limited resource for the hundreds of thousands of children that are in TA at the moment. So we kind of realised with the kind of different kind of clinical work that we're doing that this is not just a local problem to us, but it's a national issue, and the issues are similar across the board. You know, if you're in London, the numbers are way higher than if you're kind of in a more rural parts, but it affects every local authority, and everyone is struggling with different housing stock, but then also kind of the issues around accommodation and support and things like that. So our little organisation, we're about 15 of us, most of us are part-time as well. We banded together with an organisation called Just Life, who are based in Manchester and Brighton, and they work with single homeless people in temporary accommodation, and we work with families alongside other projects that we do. And we thought there's great stuff doing it locally and trying to advocate for your households here, but actually what really needs to be done is this needs to be a national-led kind of top-down approach, really. So we started the All Party Parliamentary Group, which is essentially you get MPs and peers together to chat around a certain topic. Now, there's about 700 APPGs in Parliament, which ranges everything from airline industries to certain country issues or tennis and things like that. So there's like all sorts of different interesting things. But nobody was talking about temporary accommodation as an issue. There was ending homelessness, but they were just talking about street homelessness. But nobody was talking about this kind of gap of hidden homelessness in the middle. So when we started off, we realised there was lots of issues. So we did the call for evidence and then wrote the report, which was released a few weeks ago. And you might have seen in the newspaper we had the kind of front page news on the 34 child deaths in temporary accommodation. That's over the past 3 years that the National Child Mortality Database were kind of collecting that information. And it's a complicated area to get through legislation, through regulation, and all those types of things. And we're no experts on parliamentary kind of procedures and kind of making change in that way, but we're kind of learning as we go along in terms of what things can we do nationally, but then also what things can we do locally. And you need to do both at the same time. So you can't just necessarily just talk to the national and kind of expect laws to change tomorrow, because that doesn't happen like that. That's a slow burner. But also, you can't just do local stuff. So the type of stuff that's in the report is kind of a bit for everyone, really. There's asked specifically that we want MPs to do and the government to do to kind of make sure temporary accommodation is regulated and enforced in terms of standards and facilities. But then there's lots of things that you can do locally with your local authority, with your public health teams, with education, with health as well, and linking those things up, because what we'd found that there's loads of amazing services out there, but actually there's not a lot of joined up kind of notifying of different services and things like that, and people taking responsibility for safeguarding as well, because if you've ever been to a safeguarding training course, safeguarding is everyone's responsibility. It's not just somebody else's job, because that's the whole point of it. So there's lots of different things that in that. But specifically, what would be great for you as individuals and advocates for kind of your households that you're working with, or people that you may come across, is to do your local national lobbying, if that makes sense. So you'll see this all online of people going, write to your MP about this and write to your MP about that. And actually that does work, because the MPs that we're working with get hounded by people every day about lots of different issues, but they listen to the people who are kind of advocating on behalf of these topics. So we've only got maybe 7 or 8 MPs and peers who are on our little team for temporary accommodation. And what they're planning to do is make sure that temporary accommodation in some form is regulated and enforced, and the standards are kept to a decent home standard. Now, which particular bill or amendment that's in it, that doesn't really matter at the moment. But what we want to do, basically, it's strength by numbers, really. The more MPs you can get on board to be passionate about a certain topic, the more likely it's going to get through. Which, when you think about, well, there's loads of topics that people are really passionate about, and it's really of who shouts loudest, gets the loudest voice, really. So what would be great, and I'll email kind of this, maybe like a draft email around later to Karen, is that if you could email your local MP with the link to the report going, as part of my professional work, I've come across this. It would be great if you could put your support to the APPG. And that might seem like a little insignificant thing, but actually it does the world a difference, because the more people do it and the more people are genuinely interested and passionate about it, then the more difference that makes. So it is a strength by numbers thing. And specifically around the regulation of the temporary accommodation, because there's if TA is split into lots of different kind of categories as well. So sometimes it comes under private rented, and sometimes it comes under social housing or whatever like that. So we're talking with the Department of Levelling Up at the moment of where this fits. So the kind of which amendment, which bill, and which regulation and stuff and things like that, which is a bit complicated and a bit boring, but that's kind of the nitty-gritty stuff that we're doing at the moment. Now, we've done all the report, which is all the kind of major big headlines and stuff, which has got the attention of the government. But now what we need to do is the kind of detailed work in the background. But because of MP pressure on the kind of civil servants and government, things like that, that's what, you know, are the levers of government, really. So my main call for everyone here, if you're working with families in TA, or if you're kind of interested in this topic, is to email your MP to ask them to support the ask that we've got in the APPG report, if that's okay. I can go into more details about all the other stuff that we see on as well, but maybe Emma, you want to come in at this point and kind of add in a bit more kind of like clinical know-how to what we're asking for.
Yeah, so I think just to go back, because I know when I spoke in December, we couldn't really give very many details, because at that point it was an embargoed copy of the report without the NCMD data in, because we were waiting for that to go into the iNewspaper, which it did kind of a week or so after I spoke. And so what that essentially was reporting on is we worked with the National Child Mortality Database to look at their figures, that they'd never been asked before for specific figures around temporary accommodation and how that related to the figures that they held. So they work with the Child Death Overview Panel and collate all of the data from any child that's died that's been subject to a Child Death Overview Panel within England. And they found, when they looked at their data, they looked at the deaths that had been completed for reports between the 1st of April 2019 and the 31st of March 2022. So there was 6,970 cases that they looked at. And of those cases, they found that there were at least 200 individual records where homelessness or living in temporary accommodation were actually recorded as present in the child's family life at some point in their journey. But then they also found that in another 114 cases, there was evidence of overcrowding within the property that was recorded as part of that overview of the child's death. But most importantly, and really, really tragically, that they found that in 34 of the cases, temporary accommodation was listed as a contributing factor to the ill health, vulnerability, or death of those 34 children. So it wasn't just saying that actually these children are living in overcrowded, unsuitable accommodation. It was saying that the accommodation that we're putting these children into have had a direct correlation to their death, which we all have seen. Obviously, the tragic case of Owabi Shak, who died in 2020, that he was in social housing, not in temporary accommodation. But the thought that, you know, some of the accommodation that our children are growing up in, and when we're looking at the mortality data for the most deprived areas in our country, we know that the child mortality is similar to that of Turkey, whereas when you look at the child mortality data for the most affluent areas in England, you're looking at similar to levels of Scandinavia and really low mortality rates. So I think when, you know, we're certainly looking at Oldham, where we work, is a particularly high child mortality, and we've got huge areas of deprivation, huge numbers of children in temporary accommodation. And I think there's two factors to when we look at that data of, we know that putting a family into temporary accommodation adds to their vulnerability because you're taking them away from their kind of social surroundings. You're taking them away from professionals like their local school, their GP, their health visitor, their friendship and support networks that the family might have. So we're adding a vulnerability by putting them into temporary accommodation, and then potentially that accommodation is also dangerous to their health as well. So ultimately what we're trying to do is to get more support for families that are going into temporary accommodation and to make the accommodation better. Because even if you put these families in absolutely luxurious, amazing accommodation, just the factor of putting them out of their current area and into TA is making them more vulnerable and making the child mortality risk higher to them.
Thanks, Emma. So with the kind of research that we got from the NCMD, and we had about 88 of the respondents from the call for evidence, we saw lots of similar kind of themes come across in terms of safety issues and overcrowding and kind of lack of support and things like that. So you can look into the report of all the different kind of recommendations we put into that, and you'll see that it's not a new issue. Like, we haven't stumbled across anything apart from the child death data that it hasn't already been going on. There's a report from Shelter, I think in 2012, which if you take away the dates, looks very similar to what it is now. So the situation essentially got worse instead of got better over the years. So yeah, we're kind of going around and talking to inclusion health groups like you, just to kind of get the team together to make sure that this is a safe and compassionate and healthy place for families to live. It's very, very difficult to turn off the taps of homelessness, but we can do what we can in the middle to make sure that it's as healthy, safe, and then no other child dies in temporary accommodation when they're homeless.
Thank you. Thank you, Sam and Emma. Does anyone have any questions for Sam and Emma? I think you've given us quite a lot to think about, and obviously I'm sure it will resonate with many who work in this field. It won't come as a surprise to them at all. We are keeping beautifully to time. I just want to give an opportunity if there's anyone who wants to clarify or to ask a query. Otherwise, we will go into our breakout rooms. So this is an opportunity. This is the main purpose of today's session, is to hear from you. I'm just going to briefly share the expectation of the. Let me just find my slides.
Karen, I've just put in the chat a link to a safer sleeping resource that we wrote with the Lullaby Trust. So on the back of what we've seen in the report, there's a lot of great safer sleeping resources from the Lullaby Trust in the best case scenario, but in an emergency situation, like when you're fleeing domestic violence and you get put into a B&B or temporary accommodation, there wasn't that out there. So in partnership with them, we've written that and started distributing that last week. So that's available to download, and you can order them from the Lullaby Trust themselves if you're working with families with infants. But yeah, that's all free to use. So I've just put it in the chat for if anybody wants to use that professionally.
That is really super. Thank you very much for that. I think that would be really helpful. And also your gold-plated policy if you could share that as well, and we can distribute that for you at the same time. So I know that Sam and Emma, as part of a team, are going around visiting ICSs to share some of the work. So I think that might be an offer available to local systems too, to have some insight to what's happening up in Manchester and so on. So we're going to break out into small little rooms now, and really the two questions that we are posing are these that on the slide. I hope that you can see the slide. Because there might be many of you in each room, we want to give people the opportunity. We've got 20 minutes to have a discussion. Some people feel uncomfortable sharing things in the room, so the option is to input your responses to those questions using Slido. That will appear in the chat box in the room when you're in there. And so there is that opportunity. And also afterwards, if the discussions of the day prompt thoughts later, there will be the opportunity to feed in after the meeting as well. So if that's your style of contributing to stuff, there is that option available. So Alec, would you very kindly take us into our rooms, and then I will see you all back here in about 20 minutes. Hello, thank you. That did not seem like 20 minutes for us in our group. So, so thank you everyone for participating in your breakout rooms. Without further ado, we're going to go to our next speakers. This is Nicola Munday, my old colleague, and Anna Miles from Surrey Heartlands ICS. Nicola,
sorry, I was sharing my scarves. Have I shared up too early?
No, you go for it. No, that is perfect. So Nicola and Anna are here to speak today. So Nicola is one of the leading professionals in the running the CDOP panel within Surrey, and her colleague Anna is one of the project managers on a specific project that came as a result of some of the learning from the CDOP reports, and some national funding was made available. But over to you both. Thank you.
Thanks, Karen. Sorry, it's just me because sadly Anna has to be. We have to respond if a child dies, and Anna is in another meeting about that. So sorry. So it's just me. So I'm going to speak to Anna's slides, but probably not as well as Anna. You'll have to bear with me. Oh, it's changed. Sorry. Thanks for asking me to come today. My name's Nicola Munday. I'm the Child Wellbeing Professional Lead for Learning from Child Deaths, and as Karen said, I sit in the Surrey Child Death Review Partnership, and I work closely with my colleague Anna, who sits in the Child Death Review Partnership with us, but she also project manages this piece of work around asthma. But I can talk about the asthma work, but probably if you've got really detailed questions, it would be best to ask Anna. So I don't know what everyone knows about the child death overview panels, because I know that was just mentioned earlier in terms of the NCMD, but we're a multi-agency panel and we have responsibility for, and it's a statutory responsibility around reviewing all child deaths. So for us, it's all children who are resident in Surrey. So it's every child under the age of 18 who is resident in Surrey. So each of your areas will have their own CDOP panel. And what we want to do is to better understand how and why children die, look at if there's any modifiable factors, and then look at learning so that we can prevent a similar death in the future. And we feed our data upwards into the National Child Mortality Database, so the data that was talked about earlier. I think it's worth saying, because I know we're talking about rates of child deaths comparable to other countries, but if we had the same childhood mortality rate as Sweden, then there'd be 5 in England, then there'd be 5 fewer deaths every day. So that's just under 2,000 fewer deaths every year. So and our childhood mortality rates are not favourable compared to other countries. So there's a lot we could be doing to reduce childhood mortality. What I did was, because when Karen had asked me to come to speak, was to ask, we have like a regional network of CDOPs, to ask them whether they engage with housing. And I think was a lot of response that actually they don't generally have housing representation on the CDOT panels or this meeting that takes place when children die, child death review meetings. So I think that's something maybe perhaps we could look at across the region. We have a network meeting that perhaps we might look at someone coming along to talk about this and how we could look at strengthening ties. So what we do when we look at our data of the children who've died is, Karen, will you tell me about time? Sorry as well, because I can't see a clock.
Just pick up a bit of pace, please, Nicola.
Yeah, sorry. So we what we do is we look at we collect the data on the children who've died, and I picked out the housing issues for you. So what I'm sure you'll all know about this, but we looked at the indices of multiple deprivation around barriers to housing, and these are what the indices include. And also we looked at our data compared to the living environment deprivation domain as well. So this is what it includes. I'll send the slides out so you can look at that in more detail. And if we look at Surrey specifically, we know that Surrey's got 709 lowest super output areas, and 44% of them fall into the lowest 2 quintiles of barriers to housing, and 14% of them fall into the poorest 2 quintiles of living environment. So what we did was we compared our child deaths to that, you know, we sort of compared our data. And as you can see, it's quite stark, really, isn't it? That in 2019, 54%. So we're looking sort of about half of the percentage of our child deaths have lived in the poorest 2 quintiles of deprivation in terms of barriers to housing. And then just sort of under 20% have of our child deaths are children who are living in the poorest 2 quintiles of deprivation in terms of living environment. And we know that there's a really strong correlation between child death and poverty. So when we were looking at our child deaths, we were looking at, and housing, we're looking at some of the issues. One of the big so something that came up for us really in terms of modifiable deaths is children who are dying from asthma. So we're not expecting to see children dying from asthma. It's preventable and a manageable condition. So just thought I'd talk you through a case. So we had an 8-month-old child who'd had repeated attendances at a local ED for wheeze. They were admitted to a paediatric ward on one occasion, and then they were discharged with inhalers and Montelukast, and they died, sadly died 4 days later. And when CDOT looked at this baby in their life, they identified some of the modifiable factors, which were smoking in the home. There were poor housing conditions. It was social housing, but there was a lot of damp and mould in the house, and also that we identified that the parents weren't clear on how to administer the inhalers to the child. So I think sometimes as health professionals, not always explaining clearly to parents about inhaler use. We know that's a big issue. So what happened in Surrey was then we looked at what we could do to improve asthma outcomes for children in Surrey, and at the same time there's an asthma bundle of care that was released, and the idea is that it will reduce avoidable harm to children and young people from asthma, and it's a whole system approach really, so to improving asthma, and it does look at environmental triggers, education programme, personalised care, effective medicine, and improved accuracy in diagnosis. And so all of you should have an asthma bundle of care for your locality. But what happened in Surrey was we managed to get some money to do some more work around it. So we're a pilot area as well. So in terms of housing in the bundle, it says that ICSs should be working together to lobby council services to ensure housing quality is not impacting on the health of children and young people. that children and young people at risk of or diagnosed with asthma should be placed in alternative housing if the indoor air quality is identified as poor, and that there should be, for those children with severe and difficult to treat asthma services, there should agree criteria for rehousing those children and young people when the environment's thought to be critical. So I think that's really interesting, isn't it? Because it picks up on some of the things that we were talking about in our group just now, in terms of the environment that some children are living in. So how it works in Surrey is there's an ICS-wide network in Surrey Heartlands, and we also have collaboration with other ICSs. And we've developed with West Sussex, we've adapted healthcare professionals housing referral template that we could share with everybody. We'll be publishing that. One of the issues with the housing template, though, is that at the moment the difficulty is going to be how that's accessed by professionals so they can make that referral because of the IT. So we'd like to see it sitting in a system like EMIS so that it could just be filled in when the health professional is seeing the child and the family, rather than having to download a separate form and then send it off, because we think that will affect referrals. So we plan, when the form is completed, we plan to do some promotion and communication around the form, and then also we'll look at reviewing it. And then I've just put on here, I don't know if anyone's got any questions, but also we have a future NHS collaboration platform with all the information about our learning is on that platform, so any people can apply to join that. And also there's the Association of Child Death Review Professionals. They also have a future NHS page, and they have a national conference that people might be interested in attending.
Thank you very much, Nicola.
Is that quick
Thank
enough?
you. Absolutely perfect. Any questions for Nicola? When you have your housing form developed and it's in a shareable form, would you mind sending that through? And I'm assuming that colleagues would like to see that and see it as a template that they might be able to look at implementing within their areas. We were talking in my breakout group about the communication between organisations, and that's one of the things that might be useful for other areas to learn from. Thank you, Nicola. Anyone with any questions for Nicola? Thank you very much. We're now ready to go into our second breakout room of today's session. So, Alec, do you want to do the magic button pressing? And we'll all go, and then there's a couple of questions for everyone to look at addressing, and then we'll come back in 20 minutes. So I hope you found that last exercise useful. I'm just conscious of a bit of background noise there. So we've got about 10 minutes, which isn't long, so please don't feel as though we're racing through this. The idea of transcribing in the rooms was a means of capturing everyone's comments so that we can do the legwork at the back and try and pull together a paper afterwards. But I just wondered if there were some initial thoughts and themes from our facilitators of the various groups. I'm just going to see if I can mute somebody. Vicky, would you like to go?
Yes, in terms of the second breakout group, looking at the good practice and opportunities questions, one of our colleagues raised that they were urging people to get behind the net zero pledges, because by doing that, by default, you would drive up quality if you were going for the net zero sort of environmental standards. You would sort of have to improve the quality by doing that. So I thought everybody felt in the group that was a really interesting point. Everybody was noting that down straight away. So I thought I'd share it here with the group.
No, that is really helpful actually, because that didn't come up in my breakout rooms, so that's useful to explore. Thank you. Any key issues raised for you, Jennifer?
Yeah, thank you. Issues and some sort of good practice as well. So we were hearing a little bit about some of the targeted work that's going on through sort of the housing support teams with families. So around vulnerable families and making sure that there's that sort of the visit goes out and there's an opportunity for that holistic support and linking into other services and things. So that kind of on the ground frontline support and how that can be kind of, when that's kind of quite well resourced, that sounds like that's working quite well. And we had a couple of examples of sort of floating housing support kind of around those families that includes families with temporary accommodation, but is also obviously wider to families with sort of other sort of vulnerable housing needs as well. So that was something really positive to reflect on. But we also spoke about some of the challenges that we were hearing from some housing officers around some of the challenges around the lack of standards, and maybe we're trying to find the right word for it, but maybe sort of scrutiny in terms of the housing standards that we see in temporary accommodation and what can be done around that, and what can be done at a sort of questions at a sort of a county to district level, and whether there's anything there, and what can be done nationally, really. So it was a question back up, I suppose, to those on the call around that as kind of challenges of raising the issues that we're having today. So that's why this conversation today is good. So that's what we heard about, some of those kind of opportunities to raise those questions around quality, really. Because that's where the difference can be made. I think that was quite strong in the group. So that's a little bit of feedback.
Thank you, Jennifer. Olivia, do you have anything from your breakout room?
Couple of things, Karen. So we talked a lot about communication and how different agencies might have different systems, and without burdening people, how we could ensure that, and there were suggestions as simple as a phone call can be made from one agency to the next just to advise of the situation, and that might completely change the life course or the outcome of that individual, just by making sure that relevant people are aware without any further actions. And then I guess in terms of opportunities, we had a couple of points, and maybe we can take that back as part of the framework refresh. So thinking about how temporary is temporary and the impact on accessing other services, whether health and care, education, where people might be moved not too far away or much further away and therefore not want to restart, but also how schools and sometimes GP practices are very rigid about having permanent addresses, as opposed to accepting that someone might be in temporary accommodation, and the adverse impact on social attainment, educational attainment, etc. And I guess work for adults as well. And the second point was the opportunity that +5 frameworks, because there's now one for children and young people, may offer. So how do we ensure that people in transition, so they're not on the street but they're in temporary accommodation, are not forgotten and continue to be supported at that transition time that is quite vulnerable for them?
Fabulous. Thank you. I think what clearly came out of my breakout rooms was the issue of affordability in our region. Just the struggle up and down the region in terms of the lack of housing and the lack of affordable housing for people, and also in some of the more the less expensive areas, how places like London and others are placing their families in our region, and the impact that then has on those local authorities. So I think it really is quite complex. But just again, as you've identified, the communication, you know, if a family appears from, say, London, for example, they're unfamiliar with the local area, they don't know how to access local systems. So certainly a communication piece is going to be critical. For those who are new to the network and have been invited here today, what we developed during the pandemic around homelessness per se was a sector-led improvement tool, a framework, and we are currently in the process of refreshing that. I think that some of the conversation today will definitely influence the direction of how that goes forward. So we will look at exploring that further. The other thing I wanted to share was which wasn't explicit in the conversations, was the recommendations of the APPG report. And these are some of those recommendations. I've just popped it in the chat box. I think what came out today is there's clearly some work that we could work as a network collectively on. I'm thinking of perhaps around the support for housing officers, element 3, and element 4, the holistic support for homeless households. I think there's something that we can do, a piece of work going forward, looking at how we can support you in being able to do some of that work locally. I think Fiona in one of my groups said that there's a piece for region and national on this, and your local voice is really important for us to be able to amplify that. But then there's clearly a role locally, and I think what came out of the conversation was just being in the room with different professionals from different areas and hearing what's going on is what's missing at the moment. So I hope that you found today helpful from that respect. Just wondering if anyone else would like to comment on what they've heard today or what they'd like to share or some pointers for going forward. Vicky?
In terms of pointers for going forward, in the breakout, it was clear that people would like some objectives, some deliverables for the network to think about getting behind. And also the communication for the group as well is in between meetings. How does the network communicate with each other in terms of sharing ideas, practice, support for each other? So I think it was definitely around those deliverables for the group to do something. So an example of that we were talking about was perhaps for the net zero, is that something that everybody could go away and look at and come back and as a group feel that they've really influenced that. So it was the idea around having some sort of key deliverables as well as sort of lobbying and consultation type work as well. And I think one of the other things that came a step before that was it was very interesting listening to the areas of good practice as well. Despite all of the very real and quite significant challenges, there were some real areas of celebration in there and specialist posts as well that can be shared and looked at across the region in terms of what other people are standing up and funding.
Thank you for that, Vicky. And just to say, so I coordinate the network. I've got slightly, I'm in a difficult position because some of you have been invited. So the invite has gone to you, but I might not necessarily have any of your details. So for those on the call where that is the case and you're not usually a member of the Homelessness and Inclusion Health Group, if you can email me, I'll put my details in the chat. I will add you to the distribution list. And obviously it's a broad subject area, and what we might have to do and consider is whether we have a subsection of that network that looks specifically at this. But I'll take your comments on board, Vicky. But just to be mindful in terms of GDPR, I do need to have your permission to add you to the, I've been making some assumptions these last couple of meetings, but if you'd like to be part of the network and on the distribution list, please let me know. Prince?
Hi, Karen. Just on reflection, I just wondered whether or not there is, we sometimes, I mean, this is probably just not unique to our network, but perhaps some of us who go from one meeting to another almost on the throughout the day, it just sometimes, it almost seems like we have information overload. I don't know anybody else who feels like that, but sometimes, it's just, sometimes you want certain information at a certain time, and what you don't want to do is to be throwing through a haystack of things before you get to what you're looking for, because that just takes time. And I guess just adding to that, it's just a bit that, I don't know, it is a bit where we maybe try and focus on just the things, one or two things that we really believe as a network that will make a difference, right? I mean, there's lots of things we could do, and there's so many branches and spins off from what we can do, and we talk about multiple exclusion, etc. There's so many things, but we really need to pin it down to a couple of things that we're not saying it is the only thing, the only play in town, but we're saying these are the areas where we as a network can really, kind of bring our influence to bear. And I think for me, that would be much better use rather than trying to do everything, because the network has generated so much information and it's good, it's all good stuff. But there's just no way I can get through some of them. It's just not going to happen. There's only one of me in a sense. So I need the things that I believe I can contribute to the network that will make an impact, but also will make a difference in my local area, if that makes sense.
It does. It makes perfect sense. And I think that was what we were trying to create with the framework, was to give you a tool by which that is all those issues you've described is in one place. So it acts as a means by which you can find information, because it will signpost to the relevant areas and data, but also give some clear principles and guidance as to what local areas can aspire to. So I think that that was what our intention was with the original framework, and clearly is an intention and aspiration with the work going forward. I'm hoping that that as a tool will be able to answer some of the queries that you've just set out there. But yes, by all means, email me and say what you think that those couple of things that we can focus on are. I'd be grateful for that. Just want to say for everybody on the call, because I'm conscious that we're coming towards the end of our meeting today. The plan is to, as you know, we transcribed all of the meetings. We will pull together a paper which describes the themes of the discussion today, and with some next steps. So bearing in mind what Vicky said about communicating, so the regularity and some structure as to how we take that forward. And then also maybe some proposals, Prince, outlining some of maybe a work plan or an action plan for the network for the coming year. But certainly I do feel that this will be one of those big things that we do need to focus on, because I think it is going to affect all of our jobs at some point throughout this next year, because the sense in the room was that we're in a perfect storm. I'm conscious that we've got 1 minute left. I'd like to thank everyone for their contributions today. I'd like to thank our speakers. Sam, who stayed for the meeting, thank your colleague Emma for me. Thank you very much, Nicola, for coming today and representing Surrey Heartlands with your piece of work. I'd like to thank my facilitators who stepped up today and done a superb job in the rooms. But lastly, thank you to you all. Excuse me, for your input today. It's been really appreciated. We will be back in touch very, very soon with a paper for you. So thank you.
Thanks, Karen. Cheers.
Take care,
Thanks,
everyone.
Karen. Bye.